I've been the Pike County Commissioner for 12 years with lots of vision in the very beginning when I became commissioner. When I became commissioner, I was very involved in bringing senior housing, expanded senior housing into Pike County. I also had a vision and a passion for addressing the opioid addiction issue and formatting one of the first lawsuits against the manufacturers of opioids. And it's always been my passion to make sure that the people in our community, whether they be veterans, but particularly people with disabilities, have the services that they need in our community. So many times these individuals, what I call living on the margins, don't have the same opportunities that we have. And some of them, and in the case of the veterans, are suffering from maybe drug addictions, but also suicide rates in Pike County for veterans is no different than it is in the rest of the nation. Being a commissioner is trying to solve problems. And that's exactly what I bring to the job, is problem solving. I've figured out ways to solve these. I've figured out ways to build on our infrastructure when it comes to bridges. And that to me is why I am Pike County Commissioner. Prior to this job, I was the Milford Borough President for 25 years, serving on that board for 30 years. And it was the same thing there. It was working with the community and coming up with solutions with problems that faced our residents. I believe my experience speaks volumes. I believe my record shows the things that I've done. And so I'm just asking people to reelect me for another term so that I can continue on those visions.
And one of the good issues that I see facing voters this election season is access to health care, especially in the rural areas of the county. What measures do you recommend to guarantee that residents in remote parts of the county or residents receive high-quality healthcare services, particularly considering that Pike County lacks a hospital?
Pike County doesn't only lack a hospital, it lacks an urgent care also. We're one of 67 counties in the state that has that distinction. Not a good distinction. The reason for that is it's a very long story as to why the county is in this position. It has to do with the way the county was developed and the way it was settled, even going back 200 years. It was settled from east to west. For the eastern part of the county, which was the highest populated up until 1980, we had a hospital. It was in Port Jervis, New York. As the county grew, though, for the last 43 years, we have seen an influx of people living in the center part of the county. What we have done to address that is we are working diligently with Northwell Health and another Pennsylvania-based medical service to bring 2 urgent cares into this county. The current commissioners have been doing this for the last 3 years. They both have leases on buildings, an urgent care on 739 near the Weiss Market in Delaware Township, and another one on a building in Palmyra Township, which is a township that is up by the Lake Wallenpaupack region. We're working diligently. We have also formulated a medical foundation with a group of individuals in our community to help raise funds so that we can expand even more medical services, such as a neighborhood hospital. This is the vision that we have. It's not just a vision. These plans are putting in place. They are hard plans to put in place. This is large investments by everyone to do this, but we see as this county grows that we will be able to satisfy those needs. We know that there's a lot of needs of medical in this community, and it's been going on for a very long time. And like I say, there's lots of reasons for that. The other thing we've done with medical is we have bolstered and enhanced our EMS services, our ambulance services. 3 years ago, our ambulance services was, like many areas, lack of volunteers. And again, no one's fault for this. But what we did is we went to our partners at the municipal levels, because ambulance service in Pennsylvania is the responsibility of supervisors and borough council people in the municipalities. The problem is it wasn't that the system was broke. The system was broke financially. So we needed to figure out a way, this is problem solving, how we can help our township officials get paid staff in these ambulances. So what was a crisis 3 years ago, when ambulances were taking 30 minutes to get to a house in Shahola, those response times are now down to 10 minutes. And the reason being is because there is ambulance services in every facility in the county that is active and ready to go at a moment's notice. And that is a paid staff. Now, they're not all 24-hour because some municipalities are larger than others, but the ones that are larger do mutual aid. This is a community effort. We all live in the community. We all expect an ambulance to come to our aid, and we're not really particular on where it comes from, but they need to be available. That's what community is. Community is caring about your neighbor. So the county commissioners address the EMS services. This is a model in the state that no one else has done. We have been recognized by the state, what they call the Pike County Plan when it comes to ambulance service. The other thing we did was we were able to develop a fund where we train anybody in our county that wants to be trained to become an EMT. We have a full scholarship program at our facility in Blooming Grove where we have instructors, and we will teach people how to become and get certified as an EMT. Anyone can come. It's all paid for, the testing, everything. So that has helped greatly with both volunteers and also paid staff. When it comes to medical, we are doing the things that we need to do to enhance it. Other medical things that we've done, I can go on. We have tick-borne disease task force, which is also recognized in the state because we recognize that as a health crisis in this county 7 years ago. We work continually to make sure that the residents are healthy and these services are out there.
One of the concerns voiced by Pike residents pertains to the impending construction of a sizable warehouse in Milford. They worry about the potential issues with increased traffic, strain on local infrastructure, and the warehouse's location, which is said to be directly over aquifer. The question that arises is, can Pike County effectively manage growth while safeguarding the environment, or this is a challenging issue to strike?
It is a challenge. It's a challenge in every community, not just Pike County. That location is in Milford Township. So as opposed to maybe other states, county commissioners do not do land development nor zoning. That is left at the municipal level. No one in the commissioner's office advocates or supports anything that's going to pollute the water in Milford or wherever. And just on a side note, I live in Milford, so I drink the water every day. But at the same time, the zoning of that property, how that property became zoned for that use was by township officials, not by county officials. So while people are asking the county to render an opinion about this and come in and try to get involved in the whole process, that's not our role. In fact, we have no role in it. We have no vote in it. We have nothing. The township officials do. And the township officials, I trust, are going to do the right thing. That's a really difficult job being a township supervisor because you need to determine where these zones are going to be placed. And that property was zoned for warehouses. Eventually, somebody's going to come through and think that's a good spot. The process is going through on a conditional use hearing. Again, people have asked us to come in and comment and be opposed to it or be whatever. We are neutral on it because, and this also comes from the fact of our solicitor who says we have no place there to be rendering a decision one way or the other. Because if we do, and this thing gets appealed, it's going to go to court in Pike County. And what we're being told is that what can happen then is, depending on where the lawsuit would go, is that we're not going to get a fair shake here in the county because the county's already been opposed to it. I appreciate the concerns people have, and I am concerned also about traffic, but it is a zoning and land development issue that is solely at the discretion and the decision of township supervisors, and that being, in this case, Milford Township, and that's true in any other municipality. They create the zoning. My suggestion recently to residents was, if you are concerned about zoning, you should be going to your township, getting the zoning map, and seeing what it is that's been laid out. I'm not telling you that the supervisors are wrong. I'm not, because, again, I did that job for 25 years in the borough of Milford. Those are hard decisions to make. But the public needs to be involved as the process is going on and be educated on what's zoned where before it becomes an application, because now it's an application. The zoning up on the top of the hill is of concern. The water conditions is a concern, but we'll just have to let the process work through.
Let's talk about housing. Given the scarcity of affordable housing in the county, especially for low-income families, how do you plan to ensure the continuance or development of accessibility for housing for all residents in Pike County?
I said earlier when we started, when I was elected in 2011, I heard there was a discussion then. This is not, many of these are not new topics. There was an issue then of needing more senior housing. I was able to bring a developer in here who built 3 units in Westfall Township, and now there's a total of an additional 135 more affordable senior housing units there. The other part of the population that needs housing is worker housing, and there's also housing needs for people with disabilities. And there's also a housing need for veterans. So I'll speak to all of those. So when it comes to worker housing, we need to figure out where they're going to go. The problem that we run into, though, is if you're going to put in large complexes, and we'll go back to the senior housing in Westfall. The reason the senior housing is located in Westfall is because there's central sewage. Pike County lacks infrastructure. The infrastructure particularly is central sewage. Now, central sewage and where it goes and how it goes is at the determination of the township supervisors. I don't want this conversation to sound like I'm laying everything onto them, but it needs to be understood that the responsibilities for these type of things are directed by land development and zoning. And the township supervisors, while we help them determine if they want central sewage, and we did down here in the Eastern Corridor, we gave grants to Matamoros, Westfall, Milford Township, Milford Borough to complete what they call in Pennsylvania an Act 537 plan. That is a sewage modular plan. That is not the county can't do a 537 plan. We don't have a place there. The person that does this is each municipality. So if we're going to have housing for people with affordable housing, worker housing, we need to think about how we can have the infrastructure. It's hard to build these type of facilities on sand mounds and in-ground systems. When it comes to veterans housing, we are currently working right now with an organization to work on veteran housing in the Lehman Township region. It's early on. This just started in the last couple of months when somebody came to us and said, I want to pursue this. These are private developers. This is not county-owned housing, by the way. The last one is, and this is really a very important part of our population, and that is people with disabilities. So people with disabilities need to know that when they come out of high school that they have a number of opportunities with them, that they have jobs and they have places to live. We are working on jobs right now by creating a vocational training center on Bennett Avenue for people with disabilities. The other thing is housing. The housing part of that component is we just gave a grant to Pike Autism Support Services for them to do a study to build and create a housing community with services wrapped around it for people with disabilities. That is in the process of being done. Again, these things are, some of them, depending on the size of them, get harder and harder to do when you don't have central sewage and you don't have infrastructure. I know this is for Pike County residents, but I think everybody needs to understand that the only place in Pike County where there is central sewage, central water, and central gas is between the Best Western and Walmart in Westfall Township. So there's no other place besides some private communities where you have this. We need to think as a community of how we can work together to create that, but it has to be started with the township officials, and the county will certainly support it.
Right.
At least this county commissioner will support it.
You mentioned in the beginning about opioid. This is a national problem. It's also a really local problem that we're having in all the counties. Do you believe, I know you're a commissioner, you're the incumbent, do you believe the county is taking enough action to address the issue? And what additional measures are you planning that can be implemented to contribute to a sort of a positive change in this regard?
So I have absolutely worked diligently at bringing treatment and recovery and prevention programs to this county. I have from day one of getting elected. We continue to promote educational programs in our schools. We have a program that we started in the schools called Strengthening Families, which is a after-school program that we would help to fund the school districts with, where families come together and we recognize and we teach parents as the children are in elementary school that as they move into middle school and high school, they're going to be facing some issues. I'm just going to call them risky behaviors. So we have put that in place, and it's still going on. It's a successful program. We have programs of support groups and support families in this community with Pike County residents. We have put that in place. We go to every single activity and hand out Narcan and the product that you put drugs in, and I'm sorry.
Fentanyl?
Yeah. No, we go out and recover drugs, right? We have drug drop-off points in the county, I'm sorry, that we have advocated for, and we continue to do that. As far as drug drop-off points, I'm the one guy, and you may have even read this, that was able to get a private drug drop-off in a pharmacy in Blooming Grove Township probably 8 years ago. The first one in the nation, because they would never put those in there. But when you live in rural counties, you need to be creative and come up with a vision of how we can do this. What are we doing now? The lawsuit that we filed, we're recouping money like many other counties are. We have just put together a task force to spend that money. One of the things we're doing is a full-blown educational system on the harmful effects of fentanyl and fake pills. We're all seeing this out there. We're also putting together a whole thing, what we'll call is a review team to identify people that are going either in our correctional facility and need treatment. Unfortunately, looking at the deaths of people that have overdosed, finding out were they in treatment, and if they weren't, why? What can we do better to make sure they get into treatment? This is a really difficult situation. We know that fentanyl is consuming this entire nation, and Pike County is not any different from it. But we are actively doing things to make this different. We are not sitting on our hands. We have an active, we belong to Carbon Monroe Pike Drug and Alcohol. They are aggressively out there educating the public. Malibu Ranch opened up as a drug rehab center during our time, and we helped that to bring that to fruition here. And before that, there was none in Pike County. So it is something that we work on continually, and I know the other commissioners feel the same passion. We all have been affected by this, either directly in our family by overdoses and deaths, or somebody that's very close to us. So it's something that we work very hard on.
Matt, before we go, why should voters vote for you over any of your opponents?
I think in my case of me is my experience, and I believe experience matters. If people look at my record and see the things that I've done, I think they're going to agree that this guy finds solutions to problems. We don't even touch on things like how did we address repairing the 17 bridges in this county without really impacting anybody's taxes except by using fees for registration. It's always a way to find a way to a solution, because somehow these things need to be satisfied here in Pike County. So I have the experience matters, and I'm just going to put a plug in there because I run as a team now. Because to get this job done, there needs to be sure that there's a team member here and that we work together to make sure that we're all on the same page. Not that we agree 100%. This is not a single brain, but it's more that we know what's best for Pike County. Ron Smallsley and I work extremely good together, and we believe that our vision with this medical, this is going to happen. And this is a big deal for Pike County to finally get urgent cares and a neighborhood hospital in this county. And we're going to see that gets done.
We're talking to Matt Osterberg, the incumbent seeking re-election as a Republican candidate for the Pike County Board of Commissioners. Thank you so much for talking to us and let us know about your thoughts on the issues.
Okay. Thank you.
For Radio Catskill, I'm Patricio Roballo.